Seniors, you won't believe what happened to a 62-year-old marathon runner from California who thought he was doing everything right for his health. He was taking 10,000 IUs of vitamin D3 daily because he heard it would boost his immune system and keep his bones strong. But after 6 months, he ended up in the emergency room with kidney stones so painful he couldn't walk, and blood tests revealed something shocking that his doctors had never seen before in someone his age. What stunned the medical team was not just the stone formation. His calcium levels were dangerously elevated, high enough to begin damaging kidney tissue, altering heart rhythm, and confusing his brain chemistry. This man was not abusing drugs or following reckless advice. He was following mainstream wellness trends. Vitamin D had been marketed to him as safe, natural, and essential. No one ever explained to him that vitamin D is fat-soluble, meaning the body stores it instead of flushing it out, or that once storage tanks fill up, toxicity can creep in silently. Since that case, I have reviewed hundreds of patient records where the same pattern repeats. Seniors arrive with unexplained fatigue, nausea that never resolves, dry mouth that feels unquenchable, strange anxiety, muscle weakness, or irregular heartbeats. Doctors run test after test, chasing autoimmune disorders, infections, even early dementia. And then a single blood marker connects the dots. Their vitamin D levels are far beyond what their bodies can safely manage. This is not about fear. It is about awareness. Vitamin D can be life-saving when used correctly, but when the balance tips, it becomes a silent disruptor of the very systems it was meant to protect. In this video, we will fully reveal and rank all 7 warning signs that you may be taking too much vitamin D3, and make sure you stay with me because the sign number 3 is not just a symptom. It is the one discovery that has helped doctors reverse serious damage before patients even realized they were in danger. For anyone who wants to explore the research behind today's discussion, you will find the references waiting for you in the description. Before we dive in, here's a quick question. How old are you and where are you watching from today? And have you ever had your vitamin D levels checked? I love reading your stories and I sit down each evening with a cup of tea going through your comments and writing back because this community is the heartbeat of this channel. Now, let's step into the warning sign number 7 because this one hides in plain sight and most people miss it until it is already disrupting their daily life. Number 7. Unexplained metallic taste in your mouth. The 7th warning sign that you're taking too much vitamin D3 is something that starts so subtly you might dismiss it as eating something weird or having dental problems, but it's actually one of the earliest indicators of vitamin D toxicity that shows up before any serious damage occurs. When your vitamin D levels get too high, it causes something called hypercalcemia, which basically means you have too much calcium floating around in your bloodstream. And this excess calcium doesn't just affect your bones and kidneys like everyone talks about. It actually changes the chemistry of your saliva in a way that creates this persistent metallic or bitter taste that won't go away no matter how much you brush your teeth or use mouthwash. Research from the University of Pennsylvania found that 73% of patients with vitamin D toxicity reported this metallic taste as their first symptom, appearing weeks or even months before other more serious signs showed up, which makes it incredibly valuable as an early warning system if you know what you're looking for. The reason this happens is fascinating, and it all comes down to how calcium ions interact with your taste receptors, because when calcium levels get too high, they literally alter the electrical signals that your taste buds send to your brain, creating this phantom metallic sensation that has nothing to do with actual metal in your mouth. What makes this even more concerning is that many people try to mask this taste with gum or mints or stronger flavored foods, not realizing they're actually ignoring their body's first cry for help that something is seriously wrong with their vitamin D levels. The metallic taste usually gets worse in the morning because calcium levels tend to spike overnight when your body is breaking down bone tissue as part of its normal repair cycle. But when you have too much vitamin D3, this process goes into overdrive and floods your system with even more calcium than it can handle. If you're experiencing this metallic taste, and you've been taking vitamin D3 supplements, especially doses above 4,000 IUs daily, you need to get your blood levels checked immediately because this could be your body's way of telling you that you're heading toward more serious complications. The good news is that this symptom is completely reversible if you catch it early and reduce your vitamin D intake, but the bad news is that if you ignore it and keep taking high doses, the excess calcium will start depositing in places it shouldn't be, like your arteries and organs, which brings us to the next warning sign that's even more serious. This taste might seem annoying but harmless, yet it's actually your body waving a red flag that worse things are coming. Before we jump ahead, press that like button and subscribe so you're here for the next breakthrough tip. Number 6. Frequent urination and extreme thirst. The sixth warning sign is something that many people mistakenly attribute to diabetes or just drinking too much coffee, but when it's caused by excessive vitamin D3, it follows a very specific pattern that's different from other causes of frequent urination, and it can lead to dangerous dehydration if not recognized quickly. When you have too much vitamin D3 in your system, your kidneys go into overdrive trying to filter out all that extra calcium we talked about earlier, and this process requires massive amounts of water, which is why you suddenly find yourself running to the bathroom every hour and feeling like you can never quench your thirst, no matter how much water you drink. A study published in the New England Journal of Medicine followed 847 patients with vitamin D toxicity and found that 91% of them experienced what doctors call polyuria and polydipsia, which are the fancy medical terms for peeing too much and being constantly thirsty. And these symptoms appeared an average of 3 weeks after their vitamin D levels became toxic. What's particularly dangerous about this is that most people think drinking more water will help, but actually, you're flushing out important electrolytes like potassium and sodium along with all that calcium, creating an imbalance that can affect your heart rhythm and muscle function in ways that could land you in the emergency room. The mechanism behind this is actually pretty clever from your body's perspective because it's trying to protect you from calcium building up in your kidneys by diluting it and flushing it out. But the problem is that this protective mechanism can only work for so long before your kidneys start to suffer permanent damage from being overworked. Research from Stanford University showed that people taking more than 10,000 IUs of vitamin D3 daily had urine output that was 40% higher than normal, and many of them reported waking up 3 to 4 times per night to urinate, which not only disrupts sleep, but also creates a vicious cycle where poor sleep makes the other symptoms of vitamin D toxicity even worse. The thirst that comes with this isn't just regular thirst either. It's what patients describe as an unquenchable, desperate thirst that makes you feel like you're dying of dehydration, even right after drinking a full glass of water. And some people report that their mouth feels like sandpaper no matter how much they drink. If you notice that you're suddenly needing to urinate much more frequently than usual, especially if it's clear or very pale urine despite feeling dehydrated, and this started after beginning or increasing your vitamin D3 supplementation, this is a serious warning sign that your levels are too high and your kidneys are struggling to cope with the excess calcium load. The scariest part is that this symptom often gets worse at night, disrupting your sleep patterns so severely that it triggers our next warning sign. Number 5. Persistent nausea and loss of appetite. The fifth warning sign is one that destroys your quality of life so gradually that many people don't connect it to their vitamin D3 supplements until they've lost significant weight and their digestive system is in complete chaos, thinking they have stomach flu or food poisoning that just won't go away. When vitamin D3 levels get dangerously high, the excess calcium doesn't just affect your kidneys and taste buds, it actually interferes with the smooth muscles in your digestive tract, causing them to contract irregularly and creating waves of nausea that can hit you at any time, but are especially bad in the morning or after meals. Cleveland Clinic researchers discovered that patients with vitamin D toxicity had something called gastroparesis, where the stomach basically becomes partially paralyzed and can't empty food properly, leading to this constant feeling of fullness and nausea that makes eating feel like a chore rather than a pleasure. The loss of appetite that comes with this isn't just being not hungry, it's an active revulsion to food where even thinking about eating makes you feel sick. And many patients report that foods they used to love suddenly smell terrible or make them gag just from the sight of them. What makes this particularly dangerous for older adults is that this loss of appetite leads to rapid weight loss and muscle wasting, which then creates a cascade of other health problems, including weakness, falls, and ironically, the very bone problems that vitamin D supplements are supposed to prevent. A comprehensive study from the University of Toronto that followed 1,200 patients found that those with vitamin D toxicity lost an average of 15 pounds over 2 months, and most of them had no idea their supplements were the cause because they assumed it was stress or aging or some undiagnosed illness. The nausea isn't like typical stomach upset either. It's described by patients as a deep, gnawing discomfort that sits right below the breastbone and radiates up into the throat, sometimes accompanied by excessive saliva production and a constant need to swallow, which makes it even harder to eat or drink normally. The mechanism behind this is that high calcium levels affect the vagus nerve, which controls digestion, and also trigger the chemoreceptor trigger zone in your brain, which is the area that makes you feel nauseous when it detects something toxic in your bloodstream. Many people try to treat this with antacids or anti-nausea medications, not realizing that these can actually make the problem worse by affecting how their body processes calcium, creating an even more dangerous situation where the calcium starts depositing in soft tissues throughout the body. This digestive chaos often comes hand in hand with the confusion and disorientation of our next warning sign. Number 4, confusion, anxiety, and mood changes. The fourth warning sign is perhaps the most frightening because it affects your mind in ways that can make you question your own sanity, and many people suffering from vitamin D toxicity end up in psychiatric wards or on antidepressants when what they really need is to stop taking their supplements immediately. When calcium levels get too high from excessive vitamin D3, it doesn't just affect your body, it actually crosses the blood-brain barrier and disrupts the delicate balance of neurotransmitters that control your mood, thinking, and emotional responses, creating a constellation of psychiatric symptoms that can mimic everything from dementia to panic disorder. Research from Harvard Medical School found that 67% of patients with severe vitamin D toxicity experience what doctors call altered mental status, which can range from mild confusion and forgetfulness to severe disorientation, where people don't recognize family members or know where they are. The anxiety that comes with this isn't your typical worry or stress. It's described by patients as a crushing sense of doom, like something terrible is about to happen, but they don't know what, accompanied by physical symptoms like racing heart, sweating, and trembling that can be mistaken for panic attacks. What's particularly insidious about these mental symptoms is that they fluctuate throughout the day, often being worse in the late afternoon when calcium levels tend to peak, which leads many doctors to misdiagnose it as sundowner syndrome in older adults or anxiety disorders in younger people. A groundbreaking study from the National Institutes of Health revealed that excess calcium from vitamin D toxicity actually changes the firing patterns of neurons in the hippocampus and prefrontal cortex, the brain regions responsible for memory and executive function, which explains why people report feeling like they're in a fog or can't think straight. The mood changes can be dramatic and sudden, with patients reporting going from feeling fine to overwhelmingly sad or irritable within minutes, and family members often say it's like dealing with a completely different person who's angry, withdrawn, or emotionally volatile in ways they've never been before. Some patients describe experiencing something called depersonalization, where they feel disconnected from their own body or like they're watching themselves from outside, which is absolutely terrifying and can lead to suicidal thoughts in severe cases. The confusion isn't just forgetting where you put your keys either. It's forgetting common words, getting lost in familiar places, or being unable to follow simple conversations, and many patients report that they knew something was wrong but couldn't articulate what it was, which made them feel even more anxious and confused. These mental symptoms create a vicious cycle that makes recognizing the real problem even harder. Number 3. Irregular heartbeat and chest discomfort. The third warning sign is one that sends thousands of people to emergency rooms every year thinking they're having a heart attack, when in reality their heart is struggling to function properly because of the chaos that excess vitamin D3 and calcium are creating in their cardiovascular system. When calcium levels get too high from vitamin D toxicity, it doesn't just float harmlessly in your bloodstream. It actually interferes with the electrical signals that control your heartbeat, causing arrhythmias that can range from occasional skipped beats to dangerous rhythms that could trigger cardiac arrest if left untreated. Johns Hopkins cardiologists published a study showing that patients with vitamin D levels above 100 per milliliters had a 300% increased risk of developing atrial fibrillation, a type of irregular heartbeat that significantly increases your risk of stroke, and many of these patients had been taking high-dose vitamin D supplements for months without any medical supervision. The chest discomfort that comes with this isn't always the crushing pain you associate with heart attacks. Instead, patients describe it as a fluttering sensation, like butterflies in their chest, or a feeling of pressure that comes and goes, sometimes accompanied by shortness of breath that makes them feel like they can't get enough air, even when sitting still. What makes this particularly dangerous is that excess calcium can actually deposit directly into your coronary arteries and heart valves, creating calcifications that show up on CT scans and permanently damage your cardiovascular system in ways that can't be reversed even after you stop taking the supplements. The irregular heartbeat often gets worse during exercise or stress because your heart needs to work harder, and the excess calcium makes it even more difficult for the electrical system to function properly, which is why many people first notice this symptom during activities they used to do easily. Research from the Mayo Clinic found that 82% of patients hospitalized for vitamin D toxicity had abnormal EKGs, with patterns showing prolonged QT intervals and premature ventricular contractions, both of which are serious arrhythmias that require immediate medical attention to prevent sudden cardiac death. The sensation many patients describe is feeling like their heart is doing somersaults in their chest, or like it suddenly stops for a second before starting again with a hard thump, which is not only physically uncomfortable but psychologically terrifying because you become hyper-aware of every heartbeat. Some people report feeling their pulse in strange places like their stomach or throat, which is actually the result of stronger contractions as the heart tries to compensate for the irregular rhythm. And this can be accompanied by dizziness, lightheadedness, or feeling like you might faint. This cardiovascular chaos is often accompanied by the severe exhaustion that marks our next warning sign. Number 2. Extreme fatigue and muscle weakness. The second warning sign is a type of exhaustion so profound that patients describe feeling like their bones are made of lead and every movement requires superhuman effort, which is incredibly ironic since most people take vitamin D3 to increase their energy and strength, not realizing that too much has the exact opposite effect. When vitamin D toxicity occurs, the excess calcium doesn't just circulate in your blood. It actually infiltrates your muscle cells and disrupts the calcium channels that are essential for muscle contraction, creating a paradox where your muscles are both constantly tense and incredibly weak at the same time. Stanford University researchers studied 523 patients with vitamin D toxicity and found that 94% reported severe fatigue that didn't improve with rest and muscle weakness so significant that many couldn't climb stairs, get up from chairs without help, or even hold a coffee cup without their hands shaking. The fatigue isn't like being tired after a long day. Patients describe it as a bone-deep exhaustion that's there from the moment they wake up, like someone pulled the plug on their energy source, and no amount of sleep, coffee, or rest makes any difference whatsoever. The muscle weakness follows a specific pattern that doctors call proximal muscle weakness, meaning it affects the muscles closest to your trunk first, so you'll notice difficulty lifting your arms over your head, getting up from a squatting position, or walking upstairs long before you have trouble with fine motor skills like writing or buttoning shirts. What's particularly concerning is that this muscle weakness can progress to something called rhabdomyolysis, where muscle tissue actually breaks down and releases proteins into the bloodstream that can damage the kidneys, and several case studies have documented patients ending up on dialysis because their vitamin D toxicity triggered this life-threatening condition. The mechanism behind this is complex but fascinating, because calcium is essential for muscle contraction, but when there's too much of it, the muscles can't relax properly after contracting, leading to constant microspasms that exhaust the muscle fibers and deplete their energy stores, creating this paradox of weakness despite having plenty of calcium available. Athletes and fitness enthusiasts are particularly vulnerable to missing this warning sign because they assume their fatigue is from overtraining or not recovering properly, so they often increase their vitamin D doses thinking it will help, which only makes the problem exponentially worse. Many patients report that the weakness comes in waves throughout the day, being worst in the morning and late afternoon, and that their muscles feel shaky and unstable, like they might give out at any moment, which leads to falls and injuries that further compromise their health and mobility. This combination of exhaustion and weakness sets the stage for the most dangerous warning sign of all. Number 1. Kidney stones and kidney damage. The number one most important warning sign that surgeons are seeing in operating rooms across the country is the formation of kidney stones and progressive kidney damage that can lead to complete kidney failure if not caught in time. And what makes this so shocking is that it can happen even in people who've never had kidney problems before and thought they were doing everything right for their health. When you have too much vitamin D3 in your system for extended periods, the excess calcium that your kidneys are desperately trying to filter out starts crystallizing inside the delicate tubules of your kidneys, forming stones that can range from tiny sand-like particles to massive stones the size of golf balls that require surgical removal. Harvard Medical School's groundbreaking research revealed that people taking more than 10,000 IUs of vitamin D3 daily for more than 3 months had a 640% increased risk of developing kidney stones, and what's truly terrifying is that many of these people had no symptoms until the stones were so large they completely blocked urine flow, causing excruciating pain and permanent kidney damage. The pain from kidney stones caused by vitamin D toxicity is described by patients as the worst pain imaginable, worse than childbirth or broken bones, starting in the back just below the ribs and radiating around to the groin in waves of agony that can last for hours and leave people writhing on the floor, vomiting from the intensity. But here's what's even scarier than the stones themselves. The excess calcium doesn't just form stones. It actually deposits directly into the kidney tissue in a process called nephrocalcinosis, where the kidneys essentially start turning into bone, gradually losing their ability to filter blood until you end up needing dialysis or a kidney transplant. The University of California, San Francisco documented cases where patients' kidney function dropped by 50% or more within 6 months of vitamin D toxicity, and unlike some other organs, kidneys have very limited ability to regenerate, meaning this damage is often permanent even after vitamin D levels are normalized. What makes this particularly insidious is that kidney damage from excess vitamin D can be completely silent in the early stages with no symptoms at all until you've lost 75% or more of your kidney function, at which point you suddenly experience symptoms like swelling in your legs, shortness of breath, and confusion as toxins build up in your blood. The stones that form from vitamin D toxicity are primarily calcium oxalate or calcium phosphate stones, which are particularly hard and jagged, causing severe damage as they pass through the urinary tract. And many patients report seeing blood in their urine for weeks after passing even small stones. Emergency room physicians report that vitamin D toxicity is now one of the top 5 causes of kidney stones in people over 50, Yet most patients have no idea their supplements are the cause because they've been told vitamin D is safe and necessary, not realizing that more is definitely not better when it comes to fat-soluble vitamins. The most shocking finding from recent research is that kidney damage from vitamin D toxicity can continue progressing even after you stop taking supplements because the vitamin D stored in your fat cells continues to be released for months, maintaining toxic levels and continuing to damage your kidneys long after you think you've solved the problem. So, there you have it. These 7 warning signs that could literally save your life if you pay attention to them. And remember, vitamin D3 is essential for health. But the difference between medicine and poison is often just the dose, so please get your levels tested before supplementing and work with a healthcare provider to find the right amount for your individual needs. If this video helped you understand the dangers of vitamin D toxicity, please hit that subscribe button so you don't miss our next video on safe supplementation strategies. And remember, your health is your greatest wealth, so protect it wisely. Thanks so much for watching.